Here is the latest legislative news from the Texas Hospital Association, April 3rd, 2023. Advancement of several THA priority bills provided highlights of last week's activity at the Capitol, but it was the temporary shelving of immeasurably dangerous legislation that brought a sigh of relief across the Texas hospital community. THA mobilized its membership early in the week to vehemently oppose House Bill 1692, which, as drafted, would have outlawed hospital outpatient payments at every hospital in Texas. Those payments, also known by the broader term facility fees, are essential to keeping off-campus outpatient clinics open across Texas and preserving access to care. Hospital outpatient payments fund all aspects of patients' care aside from physician payments. Without them, hospital outpatient services wouldn't be possible in Texas. The bill was scheduled to be heard at last Thursday's hearing of the House Select Committee on Healthcare Reform, where THA and others were to testify in opposition. Ahead of that hearing, THA issued an action alert urging its members to contact lawmakers on the committee and stress the importance of opposing House Bill 1692. A news release and outreach to media were also a part of THA's aggressive push to stop the bill. After that effort kicked into gear, the bill's author, Representative James Frank, decided to pull House Bill 1692 from Thursday's committee calendar to rework the legislation, giving hospitals and their advocates breathing room and more time to advocate for preserving the continued sustainability of outpatient services. THA will continue to work with its members and lawmakers on this crucial issue and keep tabs on the progress of House Bill 1692. Aside from that case of addition by subtraction, hospitals also saw encouraging advancement on several beneficial pieces of legislation. Two crucial bills were voted out of committee last week: House Bill 1890 by Representative J.C. Jatan to continue hospital-at-home programs in Texas, and House Bill 1236 by Representative Tom Oliverson, the emergency care measure known as the Prudent Layperson Bill. House Bill 1890 earned approval from the House Public Health Committee last Monday. It allows Texas facilities to operate a hospital-at-home program after receiving approval from both Medicare at the federal level and the Texas Health and Human Services Commission. Those programs proved to be an efficient and effective alternative to regular hospitalization for patients during COVID-19, allowing hospitals to expand surge capacity by treating eligible patients at home. On Thursday, the House Committee on Insurance voted out House Bill 1236, which would help ensure that health insurers can't retroactively deny coverage for emergency care based on a patient's ultimate diagnosis, but instead must base it on a prudent layperson's understanding of medicine at the time of the medical event. THA continued testifying in earnest last week on several measures for which hospitals' voices need to be heard. Among those measures were a pair of identical bills that would make it a third-degree felony to assault a hospital worker. THA Assistant General Counsel Heather De La Garza appeared before the House Committee on Criminal Jurisprudence to support those measures: House Bill 3548 by Representative Rafael Anchia and House Bill 2189 by Representative Julie Johnson. These bills continue THA's efforts to support legislation to help keep the healthcare workforce safe. This coming week, House Bill 112 by Representative Donna Howard to address and prevent workplace violence could join its companion bill in passing out of its parent chamber. The bill, which would require facilities to maintain a workplace violence prevention committee and provide at least annual training or education, is on the House calendar for this Wednesday. Senate Bill 240 by Senator Donna Campbell, the bill's companion, already passed out of the full Senate. Today, price transparency is scheduled to be on the House Public Health agenda as that committee takes up House Bill 1973 by Representative Caroline Harris, which would require providers to supply patients with an itemized bill of charges for all services. THA planned to testify against that measure. Join us again next week for more updates from the 2023 session of the Texas Legislature.